Good day! I am Dr. Wilfredo S. Tagle, Urologist, and welcome to this week's episode of Medical PracTIPS, a series of tips and tricks to help you start your medical practice. Now, for this episode, we will be talking about all the government requirements before we can start our medical practice. First, we have the local government requirements. Of course, in local government, the very basic is number one, cedula, or the resident certificate. After cedula, the professional tax receipt or the PTR. Importante po ito dahil lahat na reseta na gagawin nyo meron sa ilalim aside from your license number, under that is the PTR number. So taon-taon nire-renew po ito, your PTR. And another one, taon-taon, kailangan may bago rin kayong cedula or the resident certificate. Okay. From the national government, number one, PRC-ID or the Professional Regulations Commission ID. Ang nakadikit po dito is your license number. Sa lahat ng gagawin mong reseta, laging meron yan sa ilalim, your license number. So, importante po ito. Number two is the tax identification number or the TIN number. Ito naman po ay kukunin from the BIR. Then, number three is the PHIC. If you want to practice, have a clinical practice, all of your patients would be needing PhilHealth coverage. Lalo na ngayon, there would be a universal health which will be covered by PhilHealth. So you have to be a member of PhilHealth. You will also have a PHIC number. If you want to go to private practice, you have to be a member of the SSS or the Social Security System. You will have also another ID. And for government employees, you have to be a member of GSIS. Okay. Importante po ito. You have to pay this every month or quarterly or annually. After 20 years of practice, you will be allowed to have a pension, or this is optional. Or at the age of 65, hindi ka na tuloy-tuloy na magbabayad sa SSS or GSIS. You will have a pension on your own. Kaagipat po dito is the Pag-ibig Fund. If you are a member of SSS, PhilHealth, government requirement, you also have to be a member of Pag-ibig Fund. Kailangan din to if you want to loan for your clinic renovation, for your residence, for your house, maaasahan nyo po ang Pag-ibig. So, be a member of Pag-ibig. Okay? So, after all those requirements, still, there are some optional requirements. Number one, the S2 license. If you want to prescribe any regulated drug or prohibited drugs, you have to have an S2 license number, which is kukunin mo doon sa PDEA. Number two, pwede ka rin magkaroon ng NBI clearance. Usually, if you want to travel, get some passport or other visa, you have to have an NBI clearance or a police clearance. So yun po, those are the optional requirements. Okay? So, that's it for today's episode of Medical PracTIPS. Please follow our program every Wednesday at 7 p.m. in this blog, Medical PracTIPS. So, see you and bye-bye!